Take a breath. All set, ready to go?
Yes.
Welcome everybody to another session of virtual pitch practice, which is a program where we get together, try to work things out for our prospects. People who are trying to grow their business have to make a pitch, whether it's to an investor or to a new client or prospect where they want the business. We sit down together, we go through the presentation, we go through the pitch, and we try to get it into a position where everybody's happier than when we started. That said, I'm going to introduce myself first. I'm Steve Brett. I work with the Raise Forum at Emory University and the Nozebot Business School. I started as a full-service ad agency guy. I built an ad agency, and now I've narrowed my practice to just help business people with their public speaking and presentation skills. On the panel with me today is another guest. I'd like to introduce Orna. Well, again, let Orna introduce herself. Here's her elevator pitch. Orna?
Hey guys, I'm Orna Sharon. I'm originally from Israel. I've been in Atlanta for 8 years. Prior to that, New York, 22 years on Wall Street. Moving to Atlanta, I started working with startups and corporate innovation projects. Most recent run, 2 years, was Georgia Pacific on various innovation projects. Worked with startups from smart city to medical device to telehealth to cybersecurity. And for fun, I do some day trading, and that's it.
All right, and medical device is the key word here and why Orna's joined me, because she and I are together at this medical conference. Could be a JAMA conference, could be an AMA conference specializing in pediatrics. And we're getting on the elevator ourselves from the 19th floor. We're heading down for breakfast, and this guy comes chasing, hold that elevator, hang on a second. And you two guys hop in the elevator with us. And we know each other, Orna and I. So we take a look at your badge, see that we're all going to the same place. And we say, hey, Steve, Doc, who are you?
I'm Dr. Stephen Goudy. I'm the CEO and founder of Dr. NozeBest. As a pediatric ENT doctor, I developed a novel nasal suction device for babies to help them breathe better.
Okay. Orna, what do you think?
I think for an elevator pitch, it's good. It's short, concise, and if I have if it connects, I think of everything about elevator pitches. If it's interest for me or connect to me, you know, maybe 20-something years ago I would have when my 26-year-old needed it. Yeah, so I think it doesn't lead to anything else though, right? You didn't say anything,
right?
That wants me to. I'm like, okay, great. Hey, I'll see you around, right?
Right.
So that's where I think I'm missing the aha moment.
The hook, yeah.
That's exactly what I would have said. I like to teach beginning, middle, and end. You need to start with the hook, which you sort of did, and the explanation of the solution, and then some kind of benefit or continuation. You know, my running joke about elevator pitches is we're all getting off the elevator. You have to say something like Orna said that makes me say,
right,
let's go get a cup of coffee together and tell me more. That's the key phrase for me. Tell me more.
Right.
What could you say? How? And I'm the drama guy because I'm in marketing and sales. What could you say to bookend what you just said? A little more of a hook and a little more of a lead out to make me say, tell me more.
Yeah, I mean, I would say, you know, as the lead, as the tail end is we're scaling our team and looking, you know, to bring other people along with us.
No?
So hold on. I think Steve, I think we need to rephrase your question.
Okay.
Right? What is the objective of an elevator pitch for Steve? Right?
Right.
Is it just to, hey neighbor, nice to meet you? Or is it to generate some interest? Or is it to generate or identify potential people, like you said, that you can bring on board. Um, if I'm on an elevator with you and I'm looking for a job, that would be great, right? To know that you're looking to expand. If I'm an
Right.
investor, the fact that you're looking to expand is of no interest to me. Or maybe it is because, okay, you're growing, right? So it really depends what is your objective when you're giving your elevator pitch. You're kind of in a, I think, more complicated spot with what you're doing, right? Um, and so I think we need to think about that.
And I'm going to go back to the hook again. Um, you've told me, and I've seen from your other literature before, that babies can't breathe
Right.
when when their noses are congested. They can't
Correct.
breathe through their mouth. I think that's a kind of an
Right.
eye-opening statement. And I think that if you start with something along those lines, I mean,
Yeah.
you're a pediatric ENT. Is that fair to say?
Yes.
Okay. And so you can say, you may not know this, but, and give us some hook that really relates to us,
Yeah.
whether we're an investor looking for a unique opportunity or whether we're another doctor or a patient who needs relief. You may not know this, but babies can't breathe through their mouths, and it causes tremendous problems, followed by what you gave us and ending with some immediate benefit that then you say, well, how do you achieve that? Tell me more.
Right.
Does that make sense?
No, it absolutely does.
How does that sound to you, Orna?
No, I think it, you know, I think you're absolutely right. So that's the whole point of, you're in a sensitive position with your elevator pitch, I think, right? Because the problem that you're solving, the hair on fire problem, that for me as an investor would look for, is kind of unknown, right? I have 3 kids. Every time I left the hospital in Greenwich, Connecticut, they gave me that little pump, right?
Yeah, the little blue bulb. Yeah.
Green, blue, whatever color it was at the time. And yeah, and that was it. So I am not aware of such a problem, right?
Right.
Even as a parent with 3 kids, I'm not aware of a bigger problem that that little stupid thing did not solve.
Right.
Um, but you as a doctor know about it, right? It's your personal experience. You've seen it. You saw that there's no solution on the market, and you decided to solve it. And maybe that's, to Steve's point, that's maybe where your um, elevator pitch should focus more, I guess.
Right. No,
Maybe,
absolutely.
maybe the hook, and we're just spitballing here. Maybe the hook is, I've seen thousands, or I've seen tens of thousands of patients where the baby can't breathe because, and did you know babies can't breathe through their mouth at that age?
Right.
So I developed, and then give them the product, and then give them that benefit. So whether they're a doctor who needs to know about this to prescribe it for their patients, or whether they're an investor, now it's, here's the benefit. It can be solved,
Right.
and not with that little squishy ball and all the germs, but
Right.
you got to get to the point where you tell them that the squishy ball doesn't work, and the germs and the bacteria inside that ball is only making things worse.
Right.
So take a breath, maybe,
Yeah.
and give it another shot
Okay.
based on what we've said. See if we
Right.
can get it somewhere.
Yeah. So I'm Dr. Stephen Goudy. I'm a pediatric ENT. I am solving the problem that babies can't breathe through their mouth for the first year of life. When they get a bad cold, they end up in the emergency room. They get admitted to the hospital. We developed the Nozebot, which is a nasal suction device that addresses all these problems, and it's saving people lots of time, aggravation, and money. And we're growing our team and having a great success.
Okay, better. You got parts 1 and 2.
Yeah.
Part 3 is uh, just I would
Yep.
dramatize the success of how easy it is to solve the problem.
Right.
The mom can do it with one hand, get the whole thing done, and the baby doesn't scream its head off.
Right.
Then somebody will say, well, how do you do that?
Yeah.
And you say, come on, I'll buy you a cup of coffee and I'll explain it a little more.
Right. Right.
All right.
Yep.
Now, I would spend a few more minutes here, but you get the idea.
Yeah, absolutely.
And you can wordsmith that, or we can wordsmith it together at some later point. But in the effort to respect your time and make sure we get it, let's take a look at the deck.
Okay.
Mm.
And go through that.
Yeah. Before you start, if I just may, I'm a big fan of understanding what my market potential, right? So if you as a pediatrician, part of the American Pediatric Association, have the knowledge that your solution is solving, 30 or 60% of infants' issues, right? That 60% of all infants are facing that problem. I think that's a good number to bring to your elevator pitch, whatever
Right.
number that is. But it's just it's not about your own personal experience, right? It
Right.
makes it bigger, that across the country, because you may experience it here because of, I don't know, pollen in Atlanta or whatever Atlanta offers, but maybe in Nevada or New York, we don't experience that, right?
Right.
But when you say American Pediatric Association or something like that, I think it's much bigger than just you.
Right. No, absolutely.
Good point. Very good point. All right. You got the breakout session today. Take it away.
All right. I'm Dr. Stephen Goudy. I'm a pediatric ear, nose, and throat surgeon and the founder and CEO of Dr. NozeBest. So Dr. NozeBest is a leading healthcare company providing content-forward information for families in the upper respiratory tract space to solve unmet needs. We've all had sick children. We know that they get miserable. It's usually Saturday night at midnight. They can't breathe, they can't eat, they can't sleep. And you're looking for solutions and Googling, and your pediatrician's office is closed. And it's an emergency. You don't know what to do. And you probably don't know that babies cannot breathe through their mouth for the first year of their life. So they are complete nasal breathers. And so if they get a bad cold, they can't breathe, they can't eat, they don't sleep, and you don't sleep either. And so this is a real pain point that every family goes through. Babies get sick a lot. So the average baby gets sick 6 to 10 times a year. So that's almost every month, if not more. And if they're in daycare, it's all the time. So they will continually have this runny nose. They can't breathe. They're struggling to eat and function. Oftentimes you can get dangerous things. RSV, respiratory syncytial virus, actually hospitalizes children. They get admitted just to have nasal suctioning. And so you have to ask yourself, what are the tools that we're fighting this problem with? The issue is that there's no good problem or good solution that exists. So if you look at this picture on the top left, you can see that this mom is physically restraining her child with her left arm, literally choking him with that hold. Her right leg is holding his body. She has a device that occupies the whole hand, and she's literally suctioning or cleaning his nose with her mouth. So that's unhygienic. You only have one hand to fight this fight, and it really doesn't work that well. On the top right, you see again, the mom is squishing her baby's head to the floor, pinning it, because the baby is moving around so much because the baby doesn't want this to be done. And again, the mom is literally suctioning the secretions out of the nose. The bottom left, you can see the mom is physically sitting on her child who's screaming. She's plugging one nostril to get this little handheld, commodified, terrible suction to try to work. And then the bottom right is what we all get sent home from the hospital with, which is the blue bulb. Again, occupies your whole hand. It's hard to clean. If you look inside of it, not to be gross, but there's this dried, yucky stuff that's in there. So really poor suction, only being able to basically floss the teeth of a saber-toothed tiger with one hand. It's hard to clean. And if you're suctioning those secretions, you can get COVID. I mean, kids are, unvaccinated. There's a transmission of viral disease, flu, and others, but COVID has been transmitted that way. So the Nozebot, which is our solution, is now the standard of care for nasal suctioning for babies. And the reason why is that we provide portable, rechargeable suctioning, which is hospital grade, again, to address those babies that just need the suctioning, like the RSV that we talked about. It has a patented 2-finger design. And why that's important is because it gives you a whole hand back. So you can actually hold the baby's head and suction the nose. And so you don't have to literally either choke your baby or lay on your baby or what have you, but you can comfort and suction your baby's nose with the same hand that you're holding their face. It's dishwasher safe, so you don't have to worry about the yucky stuff that accumulates on the inside. And there's no risk that you're going to get COVID from sucking your kid's boogers. And if you look at what parents say, they say it's amazing, it's a game changer, it's the best nose aspirator ever. And these are what our reviews are on Amazon. We have 512 reviews, 4.6 stars. So the people and the families are speaking that it's addressing an unmet need. How big is this problem? So there's 4 million babies born every year in the United States. So we're, again, only selling in the US. This is not international. In the total market, if you look at all the babies, it's 2 billion. If you say, okay, well, even if we could obtain 25% of the market, that's still a $500 million market. And that's renewing every year. There's more babies that are born every year. And that's just in the US. So what is our plan? Our plan is to scale our team. We need to invest more in marketing and sales. We've identified that the more marketing and sales we do, we put $1 in, we get $4 out. So we really need to be focused on that. We have a second product, a smart humidifier, again, with the goal of being a content for a company, addressing the need for the appropriate amount of humidity, because too much is not good for you, too little is not good for you, and really being thoughtful about delivering that content to the family so they understand what are the consequences of providing the appropriate humidity, having Nozebot line extensions, and then ultimately getting into big box and retail, because this is an emergency to the families and they want the solution today. We get calls all the time. It's like, hey, I went to CVS or Walgreens or whatever. I look for your product. I don't see it. I need it today. So what are we going to use the funds for? We're raising $1 million, half of which is going to go directly to sales and marketing. We have enough product to sell in 2022. So we're good. We just need to get the information in front of the consumers. We need money to develop our second product, and we need money to scale our team. Ultimately, our strategy is to identify a larger brand that seems to play in the space. Either Graco or J&J or Crane would be examples of that. Owlet is another femtech, baby tech brand that actually IPO'd last year. Alternatively, there's lots of aggregators in the Amazon space that have been interested in different brands that are growing, and certainly we've had some preliminary conversations with them. And you can see here, this is how our product works. You can see it's a portable, rechargeable. Families need it. They love it. They don't go on vacation without it, and it's meeting an unmet need that right now, if you're willing to pay $1,000 for an iPhone that solves all of your problems, not using the blue bulb just seems archaic.
All right. Thank you, Dr. Goudy. Orna, you're up.
So my first comment is about what you said about your competitor, right? So everything was going great, and then you dropped this bombshell.
Yep.
And you stopped and you moved on. And as an investor, you scared me now, right?
Yeah.
Who is because you've mentioned the competitor, you didn't mention the name, so I don't know anything about your competitive landscape. And you didn't mention whether you went back to Amazon or not. Are you continuing to sell? Are you holding now until your legal issues with them are resolved?
Right.
And I think that's really risky at a presentation to say.
We can address this further at another time. Orna, you had some other questions as a healthcare person, a healthcare device person. We were talking, about price, about the device itself.
Well, he didn't mention the price, I think, unless I missed it, right? So the price was not listed here, but also.
Yeah, it's right there, but I didn't say that. Yeah.
But I think I would start showing the photo of that you end with, right? Because at no point when you do your presentation do I really get an idea. See, this one is
Yeah.
powerful, right?
Right.
So I don't know anything about the price. And I was telling Steve when we first talked about today, is that way back I was talking to a woman out of North Carolina who was looking to do something for warming breast milk, right? And I did some market research on baby products because, again, my youngest is 16. I haven't done it in a long time. The whole
Right.
from stroller to everything that's out in the market changed completely.
Right.
And I was floored to how many devices there are. And it seems to me that everybody's, related to that. And on the should be on any mom's to be waiting list, right? Or
Right. The registry. Yeah.
registry. But this being that it's more of a medical device, should it be part of not just registry, but more doctor's recommendation, insurance covered, et cetera? And
Right. So let's talk about go to market. Okay.
Yep.
Amazon's an obvious, but for the moment, a non-starter.
Right.
Go to market. What is the plan? Are you going retail exclusively? Are you going insurance? Are you going to other doctors? Address that for a minute.
Yeah. So we initially, when we launched, we sent 60, 70, maybe 100 units out to all of the other pediatric ENT folks that I know around the country who are the kind of key opinion leaders in the nasal space, and got feedback and did surveys and so on. So they are out kind of, proselytizing, and some of them have already committed money to invest in our seed round. As far as pediatricians go, it's a much bigger group. And it's hard. I mean, I've sent it to the people I know, like the people I went to med school with, other folks, influencers in the space. So that is how we're addressing, the medical community per se. The B2B sales, we haven't really pursued that just because that's a long sales cycle. And I'm not sure, I'm not sure that hospitals are going to buy it because they already have suction there. So, maybe it would be to insurance companies to keep people from being admitted to the hospital, or they can discharge them earlier, maybe a DME company, but honestly, that's such a long cycle that we didn't go that route. But ultimately, it is relevant. To answer your question about the big box and chain, the answer is yes, that's part of the plan, but because that is so capital intensive, that's not front and center right now, just because the cash flow issues and everything else about selling to, they're going to pay net 90 or net 120 or whatever, until we're scaled appropriately and funded more robustly, then that's not the immediate plan.
I think there is the FSA, right, store also. So if it can be identified as covered by FSA.
Yeah, it is. It is.
So that's a good marketing and promotional, I think, value, right, to the product, because a lot of people have the FSA, right, and they want to use it. So I think that should be a big focus for you guys. I think from the go-to-market. Have you done any customer discovery with the product in terms of parents actually using it, right? And price.
Right. We've talked about price.
Yeah. No, I think the short answer is no. We've got lots of anecdotal data, but have we done a broad swath of like the intent to purchase and, what are the demographics and, why did they buy it and all that? We haven't. The purpose of this raise is to have somebody in our right now it's just Chase and myself as the only employees. And I have, a full-time job. And so Chase is doing lots of things. We have contractors that do the marketing and whatever else. But we have not done what you're describing yet. We understand that we need to do it,
Yeah, the only thing I'm asking, it's not me talking to you as an investor, it's me looking at the presentation, right?
Yep.
And what other information to support your presentation would be valuable for you to show, right? So if, for example, you can get or Chase can get some of the data from Amazon or Shopify or whatever you guys are using in terms of your who bought this stuff, right?
Yeah.
Demographically and what parts of the country, if there's any age or something, that would be, or how many people opened it and decide, and how many people converted and bought it, right? I think that would be some important data for you to put some good numbers on the presentation, right? 95 people are converted the minute they open and they see, right? Versus 10% are converted. You know what I'm saying?
Yeah.
Is it?
Yeah.
So at least how many people are comfortable with the price and with the product versus how many people aren't. And I'm not a marketing expert by far, so that's more Steve, but I did work I consulted 6 months, another telehealth company here in Atlanta. And that was something that I had them do, is really understand more about who looks at their product and who is converted and who is not, right? And that's data that Google or Amazon or anybody should be able to give you, I think.
Go ahead,
looking at this presentation, and I think you guys can add more information, right? That would help convince whether it's a buyer or an investor, or if you're going to pitch to a group of, I don't know, doctors that they should promote it or use it in their office. And there's not a whole lot of information, right? So sometimes when you're in your box and you're an ENT, and God knows I needed you so many times in my life. For my
Where were
kids.
you when we needed you?
All right.
I was in New York at the time, so it didn't make a difference. But yeah, it's hard for you to look from the parents, I think, and from the consumer point of view, right? And from the investor or the general market, because you're the doctor that need to treat those kids, right? For me, and again, forget me because I'm not a good example, but I wonder, a lot of the baby devices talk about how they serve you more than just for one time period, right? Maybe more than just for the first 6 months. And you can use it later on as the baby grows, maybe until he's, I don't know, 2 or 3 or whatever, I don't know. And I'm wondering if that's something that you can do here as well. It's not show that it's a product for a newborn or 6 months old, but maybe it's a product for younger kids that have continuous sinus infections or problems, right? And I'll give you an example. My oldest had 36 ear infections the first 3 years of his life.
Wow.
Right?
Yeah.
So clearly we're up all night watching Sesame Street tapes, or believe me. So I'm aware of the problems that come with this from way back. I'm just saying, would it be nice if it worked for me year 2, year 3, and my investment would have been more justifiable, right?
Right.
It's not just a short-term or time-frame solution, I think.
Right.
We all talked about pricing. when Orna and I did a little bit of prep on this before, it would be great if we had a sense of the pricing. And I know we talked about it, you and I, Steve,
Yeah.
at one point. You know, everybody wants a product when it's $19, and at $119, the demand goes way down. You need to find the sweet spot. And in terms of everything
That's
that
a
Orna
customer
said,
discovery, right?
exactly,
Steve?
exactly.
Yeah.
That's what we need to. That's what needs to be done.
I think if I could just chime in, I think one of the interesting dynamics with our product is that if you ask people what they want to pay, they're going to say 20, 30, 40 bucks. But when they're up at 2 a.m. and their kid's screaming and they feel completely helpless,
I'll
people come
pay
on our
anything.
website. You know what I mean? They're spending close to $200 at 3 a.m. to get it to them, you know, next day. And so it's this interesting dynamic. Like the answer is completely different whether you ask them when they don't have the problem or whether they're in the middle of the problem. So
I totally agree with everything that you said. And there's ways to.
What's your competition? The Frida one, what are they selling their product for?
depending on how it's bundled, anywhere from $15 to $25.
So it's significantly different pricing than you guys, right?
Yeah, we don't, I mean, they're our competitor in the sense that they're making the same type of product, but I mean, we don't really consider them our direct competitor. You know, there are other high-end products in our space that we outperform and have better features. And
So that's where we should leave it for today.
Okay.
Steve's got places to go. I want to thank everybody for
Oh, this has been
participating
awesome.
in a
Yeah.
virtual pitch practice.
Yeah.
And I would be more than happy to continue the conversation